Okay, here we have video 2, freshly sharpened pencil, and again, I still don't have a stand or a holder for the camera, so it's going to be shaky, but, and there are a lot more words in this anatomy section, so I will try to remember to pan over. All right, anatomical triangles. The suboccipital triangle has these boundaries: rectus, capitis, posterior major, which includes C2 spinous process to occiput, obliquus capitis superior, C1 transverse process to occiput, obliquus capitis inferior, C2 spinous process to C1 transverse process. All right, the roof of the suboccipital triangle is the deep fascia covered by semispinalis capitis. The floor of the suboccipital triangle is the posterior arch of C1 and the posterior atlanto-occipital membrane. The contents of the suboccipital triangle are the third part of the vertebral artery, the suboccipital nerve, dorsal ramus of C1, and suboccipital veins. All the muscles forming its boundaries are supplied by dorsal ramus of C1 for the suboccipital triangle. Here is the illustration. You can see rectus capitis posterior minor, rectus capitis posterior major, obliquus capitis superioris. Here's the vertebral artery going through, and obliquus capitis inferior. All right. Anterior cervical triangle. Look at where this is. This is the anterior cervical triangle. The boundaries of the anterior cervical triangle are anterior midline, inferior ramus of the mandible, anterior border of SCM. That one's pretty simple. The roof of the anterior cervical triangle is the skin, superficial fascia, and investing layer of the deep fascia, cervical fascia. The contents of the anterior cervical triangle are the carotid, submandibular, submental, and muscular triangles. So let's look at those other triangles. All right. Here is the SCM. That's the edge of the trapezius. That's the posterior cervical triangle. This is the inferior belly of the omohyoid. Anterior midline. Superior belly of the omohyoid. Here's the hyoid bone. Anterior and posterior bellies of the digastric. All right, let's outline that. Cervical triangles. Here comes the carotid triangle. Boundaries of the carotid triangle are the SCM, posterior belly of the digastric, and superior belly of the omohyoid. Posterior belly of the digastric and superior belly of the omohyoid. The roof of the carotid triangle is the skin, subq fascia, investing layer of deep cervical fascia. The floor of the carotid triangle is hypoglossus, middle, and inferior constrictor muscles. The contents of the carotid are essential. Let's see if we can get that whole thing in the picture. Cranial nerve 11, 12, and the carotid sheath containing common carotid artery, internal jugular vein, and cranial nerve 10. Lying anterior to the carotid sheath are lymph nodes, and ansa cervicalis. All right, next one. Submandibular Triangle, aka the Digastric Triangle. The boundaries are posterior and anterior bellies of digastric and inferior ramus of mandible. The roof is the skin and superficial fascia. The floor is the mylohyoid, hyoglossus. I really thought that was hypoglossus, but it keeps saying hyoglossus, so I will have to look into that. And part of the middle constrictor. Contents: submandibular gland in the submandibular triangle, nodes, facial vein, facial artery, hypoglossal, and mylohyoid nerve. All right, next page. We're set up to do the submental triangle next. Suprahyoid triangle is the other name for submental. The boundaries are anterior bellies of both digastric and hyoid bone. The roof is the skin and subcu fascia. The floor of the submental triangle are the mylohyoid muscles. Contents of the submental triangle are submental lymph nodes and submental veins. The muscular triangle. The boundaries of the muscular triangle are SCM, superior belly of omohyoid, and anterior midline of neck. The roof of the muscular triangle is skin and superficial fascia. The contents of the muscular triangle are sternohyoid, sternothyroid, thyroid muscles, thyrohyoid muscles, thyroid, trachea, larynx for the muscular triangle. All right, posterior cervical triangle. Make sure the camera is getting all the words in. The posterior cervical triangle is subdivided by the inferior belly of omohyoid into the occipital and supraclavicular triangles. The boundaries are SCM, trapezius, and the middle third of the clavicle for the posterior cervical triangle. The roof of the posterior cervical triangle is the skin, superficial fascia, platysma, and investing layer of the deep cervical fascia. The floor of the posterior cervical triangle is splenius capitis, levator scapula, scalenus posterior, medius, anterior. The contents of the posterior cervical triangle: 6 vessels, subclavian artery, suprascapular, transverse cervical, occipital arteries, subclavian, and external jugular veins. 7 nerves in the posterior cervical triangle. Let's make sure it's focused. 7 nerves in the posterior cervical triangle: great auricular, lesser occipital, supraclavicular, transverse cervical nerves, trunks of the brachial plexus, and cranial nerve 11, which includes the phrenic nerve in the posterior cervical triangle. All right, that's a big one. Triangle of auscultation. Make sure we're in view here. The boundaries are trapezius, lat dorsi, medial border of the scapula. There it is, triangle of auscultation. The roof of the triangle of auscultation is the skin and superficial fascia. The floor is rhomboid major, and there are no contents. The whole point is that you can listen to the heartbeat there. Auscultation and lumbar triangles. Lumbar triangle of petit, I don't know, petit, there's no E, I guess. The boundaries are lat dorsi, external oblique, and iliac crest. The roof is the skin and superficial fascia. The floor is the transverse abdominis, and there are no contents. Here's the little triangle. And that will do it for video number 2.